Welcome back to the channel. Today, we're diving into an important topic that affects many women worldwide: pelvic inflammatory disease, or PID. It's something we don't talk about enough, and when we don't talk about these things, it can be scary when they happen to us, or even worse, we don't catch it early enough. We're going to break down what PID is, what causes it, how to recognize the symptoms, and most importantly, how to protect yourself. So, whether you're just here to learn something new or want to stay informed about your health, stick around. This information is for everyone, and I always say, knowledge is power. Let's start with the basics. PID is an infection that affects the female reproductive organs. Imagine your reproductive system as a delicate pathway. PID happens when harmful bacteria decide to take a wrong turn, traveling from the vagina up into the uterus, fallopian tubes, or even the ovaries. Now don't freak out just yet. It's not like this happens out of the blue. Most of the time, PID is caused by sexually transmitted infections, or STIs. You've probably heard of chlamydia and gonorrhea. Those are the usual suspects. But it's important to remember that other factors can also increase your risk of developing PID. These can include things like childbirth, abortion, or even some pelvic procedures. Here's the thing about PID that makes it a little bit tricky. Not everyone experiences noticeable symptoms. And trust me, as a doctor, I know that silent conditions can be the scariest because we often don't catch them until they've progressed. However, for those who do experience symptoms, they can range from mild discomfort to pretty severe pain. The most common things to look out for are pain in your lower abdomen or pelvis. Think of it like a persistent ache or cramping that just won't quit. Other signs can include fever, unusual vaginal discharge, whether it's a change in color, consistency, or even odor, painful urination, and pain during intercourse. If you're experiencing any of these, even if you're not sure, it's always best to err on the side of caution and get checked out. Okay, so let's say you're experiencing some of these symptoms, or maybe you're just concerned and want to be proactive about your health. What's the next step? Well, the first and most important step is to talk to your doctor. When it comes to PID, early diagnosis is key. Your doctor will likely start by asking about your medical history, including your sexual history. Don't be shy or embarrassed. We've heard it all, and our priority is to help you. They'll also perform a pelvic exam to check for any tenderness or abnormalities. Depending on what they find, they may also recommend some additional tests like analyzing a sample of your vaginal discharge or even doing an ultrasound to get a better look at your reproductive organs. The good news is that, in most cases, PID can be treated effectively with antibiotics. Your doctor will determine the best course of treatment based on the specific bacteria causing the infection. It's super important to follow their instructions carefully and finish the entire course of antibiotics, even if you start feeling better before you're done. Now, prevention is always better than cure, right? When it comes to PID, practicing safe sex is crucial. Using barrier methods like condoms can significantly reduce your risk of contracting STIs, which, as we talked about earlier, are the most common cause of PID. Regular STI testing is also essential, especially if you're sexually active with multiple partners. Remember, early detection is key. We've covered a lot of ground today, and I want to emphasize that taking care of your reproductive health is just as important as taking care of any other aspect of your well-being. Don't ignore any unusual symptoms or discomfort. Your body has a way of telling you when something's not quite right, so listen to it. I always say knowledge is power, and now that you know more about PID, you can make informed decisions about your health. And remember, you don't have to navigate this alone. Your healthcare provider is there to support you every step of the way. So, stay informed, stay safe, and stay healthy. If you suspect you have PID or are experiencing any of these symptoms, it's crucial to see a healthcare provider as soon as possible. Early treatment can prevent serious complications such as infertility, ectopic pregnancy, and chronic pelvic pain. Remember, your health is your priority, and seeking timely medical attention can make all the difference. Thanks for watching, and don't forget to like, comment, and subscribe for more health tips and information.